This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good Monday morning. Welcome to the latest edition of Mon Health Talk. I'm Kyle Wiggs sitting in for Dave Wilson, and we are glad you are along with us. Mon Health Talk Radio for this Monday in June, the 27th of June, 2022. And our guests this morning are Dr. Bonnie Forman and Dr. Jennifer Pumphrey with Mon Health Preston Memorial Hospital Primary Care. And ladies, good morning. Thanks for coming on.
Good morning. Good morning.
I know you both have been on previously, but let's get a little background information. Start with Dr. Forman, where you're from and what brought you to the Mon Healthcare system.
Good morning. Good morning. I was born and raised in Elkins, West Virginia, born in Elkins, but grew up in Masontown there in Preston County. I went to WVU for both undergraduate and medical school, and then to UHC in Clarksburg for my residency in family medicine. I came back to Preston County after my residency training as part of a rural scholarship program. Preston Memorial was designated a health professional shortage area, and I've been in Preston County ever since.
All right, so you've been there a while, right?
Just a few years.
Dr. Pumphrey, your story.
Yeah, I was born and raised in Harrison County, West Virginia. I went to West Virginia Wesleyan College for my undergraduate degree, but then graduated from WVU School of Medicine and also did my residency in pediatrics at WVU. I kind of started out my early pediatric career at WVU Hospital, but then was wishing for a more rural or semi-rural area, to practice. And I've been working in Preston County now for about 13 years, and I've loved being here. It's been a very good fit for me. And then I guess Bonnie and I all became part of the Mon Health system here in the last few years since we've been at Preston.
Right. Okay, so let's spend a moment and talk about the Preston County facility there in Kingwood. And it's fairly new. When did that facility open?
I believe it was 6 years ago, I want to say.
Boy, time does fly.
A little bit. Yes, it does. It does. And I should know that date. I apologize.
It doesn't seem that long ago, but 6 years ago. So just, Dr. Forman, spend a few moments to talk about what it means to have an updated state-of-the-art facility and what that did to enhance primary care for the residents of Preston County over the last 5 or 6 years.
Wow. It's great. But through our partnership with Mon Health, we were able to build this beautiful facility, which is very nice, very clean, state-of-the-art, in a good location with easy access and parking. So our facilities come up and see the place sometimes. Just everything across the board is so much nicer, and just like I said, all new facilities. Most recently, then, as time has gone by, we've been able to upgrade equipment. I know there's been a talk a lot recently about our 3D mammogram. That's something new, but just pretty much as things come available, we're fortunate enough to be partnered with Mon and have equivalent facilities across the whole Mon system. So it's been a great experience.
Dr. Pumphrey, you've as you mentioned, you've been there for 15 years, and so you know what the old was like, and you know what enhancements have come with the new. Your thoughts on that? I call it new, 6 years. It's still a new facility, but it's state-of-the-art, and it really has advanced healthcare in that community by leaps and bounds.
Yeah, I don't have a whole lot to add to what Bonnie said. It's a beautiful facility. It's clean and bright. And from a pediatric standpoint, I feel like our family practice offers a lot more pediatric-friendly rooms and spaces than the old facility did. So that, for me, has been huge.
Okay, so let's talk family medicine. The children they're enjoying their summer. Parents and students are off for the summer, but it's right around the corner, the start of the new school year in August. So let's talk a little bit about the importance of a comprehensive well child visit. I know athletes need physicals, but all children need to be seen by a physician or a pediatrician. Dr. Forman, let's start with you. What can you do to encourage people to get their children seen, get them checked out, get that well child visit during the summer when they're off?
Yep, like you said, no better time than the present. Maybe you have a little bit more free time in your schedule. And then again, you mentioned the need for the sports participation exam, which can and usually is part of the comprehensive well visit that we provide. We make sure you have special time to get a good history, do any screening exams that are needed, discuss vaccinations, and then, of course, age-appropriate counseling. Now, it can be done any time throughout the year at your pediatrics primary care office, and it's recommended once a year and is usually covered by most insurances. So the big part is, we like to discuss, you might have a reason that you're bringing your child in. You have something specific that you're concerned about. But we do like to fit in all those screening and preventative maintenance items to discuss at all ages. It's a good time to establish a relationship and an opportunity to discuss important topics that may be very key and honed into your child's particular age. Just a couple examples, we talk about water temperature when you have a newborn. It may be bicycle helmets when they're children, but then it turns into more important things like tobacco, alcohol, drugs, and prevention when you're a teenager.
Mm-hmm. Dr. Pumphrey, Dr. Forman there mentioned some screenings and some things that are commonly done when young people come to see you. What type of screenings? What are you looking for when you get a visit with a young person?
Yeah, I'd like to take this time, if you don't mind, to kind of point out, a little bit more the difference between the sports physicals and well child checks, because that pertains to your question.
Okay.
So standalone sports physicals we've traditionally done to sort of evaluate the health of young athletes, specifically in regard to their ability to participate in training and competition. So it ideally evaluates the athlete for conditions that might be life-threatening during sports or that may predispose the athlete to injury. But a well child check, on the other hand, as Dr. Forman pointed out, it evaluates the child as it pertains to every part of their health and well-being. So we can do the sports evaluation as part of their comprehensive well child exam. They don't have to schedule two separate appointments. They just need to tell us when they call. Dr. Forman, I feel like already mentioned a lot of the components of the well child check, but some of the stuff we screen for, as your question, is the child growing and developing appropriately? Sometimes a parent thinks they are, but we notice something that's off, and we can assess their overall health. We can screen for possible unhealthy conditions, and it gives the parent time to address concerns that they might have about their health or the child that has about their health. And again, it establishes a relationship with a provider in their office. So if the child does get sick during this year, between wellness exams, they've already got somebody they're comfortable with to come. They can make an acute appointment. It's much easier to make that appointment and come in and get evaluated. But it gives us that opportunity to discuss ways to prevent disease before it happens or intervene early if something is found.
Okay, this is something I'll open up to both of you, but there's been obviously an increased concern with mental wellness among young people with the pandemic and all that we've seen go on, around the country, unfortunate events, and it's just more to the forefront. So I believe it was you, Dr. Forman, that mentioned the age-appropriate counseling. If someone out there has a child or a grandchild that they think, might benefit from talking, just talking to someone, just from some counseling, are those types of services available as well?
Absolutely. Our pediatric care has really come to a lot of that mental health care in the last several years. And I feel like we're at the front lines of taking care of those things and caring for the whole child and the whole family. the other thing is that a lot of times when they schedule a well child exam, that's one of those things we automatically screen for, and that the parent might not realize until they hear their child's answer in the visit, or the child might not feel comfortable talking about until they're asked specifically. And so it gives us time to sort of address those things that might otherwise be missed. So in addition to, we're looking for abnormal lumps and bumps and heart murmurs and family history that might need follow-up labs, but we're also looking at, again, the child as a whole and their mental health and all of those things.
Okay. Dr. Pumphrey, anything to add there?
That was Dr. Pumphrey, sorry.
Oh, I'm sorry.
That's okay.
Dr. Forman, anything to add?
Yeah, no, I agree with Jenny. In primary care in general, it's become a screening at all ages. I think society and of course, the healthcare team and the system across the world have realized how important anxiety and depression even prior to the pandemic. And it's a pretty standard. We screen adults and children. You'll notice both at your primary care visits, but also at your specialists, other significant life events, whether you're seeing your cardiologist or your oncologist or any of those things, we are realizing the impact of your mental health on your overall health. So all the specialists are screening and making referrals. We do a lot of counseling together.
Okay, we're talking about young people here, but that type of mental health, that type of conversation, it's appropriate for any age. If you have issues, you need to come speak to someone, and it can start with the Mon Health Preston Memorial Facility.
Correct. And it gives us an opportunity to, if it's something that's more serious that we pick up and detect, we can get you referred to some specialty services as well.
Okay, very good. We're going to take a break here, but before we do, we're talking about the well child visits. We're talking about the sports physical screenings. How far in advance do parents need to make an appointment? Again, we're in late June already, and school is going to start in less than 2 months. So how quickly do people need to act? How far in advance do they need to give you a call?
Yeah, we have appointments available now, but they need to be calling in as soon as possible so that we can get things completed for them as soon as possible and have time available to meet their needs for pre-participation in sports or for preparing for the upcoming school year.
All right, very good. How do they reach out? What's the number there?
So you can call, if you're looking for Dr. Pumphrey and I here in Kingwood, our number is 304-329-4701.
Okay.
And, that'll link you directly into us. But honestly, our folks will help you get in touch with anyone in the area. You can also go look us up on the web at monhealth.com/primary care, and that will put you in touch with your primary care provider options in your area.
Okay, very good. We are with Doctors Bonnie Forman and Jennifer Pumphrey, Mon Health Preston Memorial Hospital. We're discussing primary care. This is Mon Health Talk for this Monday morning. Thanks for joining us. Stay with us. The conversation will continue right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday morning. Thanks for joining us. We are with Dr. Bonnie Forman, Dr. Jennifer Pumphrey. They're with Mon Health Preston Memorial Hospital Primary Care. We spent the first segment talking about young people and the well child visits and the sports physicals, and we're going to move on from that. But I believe Dr. Forman wanted to add something on the physicals and the timing about that. Go ahead, Dr. Forman.
Sure. I was just saying, if you've already had your wellness visit, and, regardless of whether we're talking adults or children, we typically combine these and talk to folks at the visit if they're playing sports. So insurance is usually paid for a wellness visit once a year that covers your sports physical. So if you're a parent and you've already seen your primary care provider earlier in the year, frequently you can call them. You don't have to make a special appointment and go in a second time. and they'll take care of it. So let's say if I see you in August and let's say your child plays a winter sport, in January, if we forgot to fill it out in August, you can just call the office and we'll take care of any paperwork that needs done. We don't want anybody to be having to make 2 appointments for one wellness visit.
Right. So, okay. Yeah, the physical and the wellness visit all kind of combined there. Okay.
Correct.
People of all ages need that primary care provider. Why is that important for people who, are in various spans of their life?
So I would say that, there's several things, a lot of which overlap with pediatrics. So if you have a specific concern and you come in, all those same things apply. Many of the things, though, in adults, you can come in with one specific concern, and during a wellness, we do all those things that are, again, age appropriate to screen for things. A common one is blood pressure. A lot of times it's an asymptomatic thing. You didn't know your blood pressure was high till you came in and we checked it. Also, diabetes is something we screen for on a routine basis that in the early stages, you may be early and asymptomatic, and we don't want to wait till you're, completely having trouble. So the key is, what is the old adage, an ounce of prevention goes a long way. And so we try to screen to prevent at every age, whether you're a newborn or you're 100, those things that if we don't take care of now and pick up early on are going to cause a lot of problems down the road. Okay.
And smoking and tobacco products. That's smoking cessation. I know that's a big thing with any medical provider.
Yes. If we could fix 3 things, alcohol, tobacco, drugs, and actually a 4th one is obesity, so we can also counsel about those things. If we could get rid of that segment of problems, it would prevent a lot of long-term complications. And we have programs built around that your primary care provider can talk to you about. And there's programs that your insurances cover, which can say, for instance, you brought up the tobacco, can include counseling, medication, all those types of things, that there is whole programs set around. It's so important that we address those.
All right, very good. And we're down to the last couple of minutes here. And Dr. Pumphrey, I did want to get you in here one last time. With the summertime, you talk about the well child visits and the sports physicals. Those obviously are important for people looking ahead, but I'd imagine this time of year you're seeing visits from kids that have just been kind of banged and bumped during their summer activities, whether it be bicycling or skateboarding or on the trampoline. Is that the type of thing you're kind of dealing with this time of year?
We see everything still this time of year, from banged and bumped and concussions to we're still seeing viral infections to just doing a whole lot of well childs and sports physical type visits at this time of year because 'tis the season to get everybody all ready for school and sports. So, yeah, we see a little bit of everything.
A little bit of everything. And, I'm sorry, go ahead.
Just to finish up on what Bonnie was saying, Dr. Forman was saying that, the blood pressure screening and the age-appropriate screening, that goes along, again, from 0 to 100. So that also is included in our pediatric screens. And another reason why we would love to promote bringing your child in for a well child check instead of just your sports physical.
Right. Very good. Okay. So reach them at 304-329-4701. That's the number for Mon Health Preston Memorial Hospital. And we've been discussing primary care this morning with Dr. Bonnie Forman and with Dr. Jennifer Pumphrey. And they're encouraging all parents out there to get your child seen, get that well child visit. If you need a sports physical, you can do that all at the same time as well. Again, 329-4701 for Mon Health Preston Memorial Hospital. Ladies, thank you. Great information. We appreciate the time, and we'll talk to you again.
All right, thanks for having us.
All right.
Yes, thanks for having us.
Thank you. That's Mon Health Talk for this Monday on WAJR.